CEO of RSA Consulting Group, and welcome to the first ever live edition of Lobby Talk. So a number of firsts today. A, we're doing this live. B, it's Natalie's first appearance on Lobby Talk. So welcome, Natalie. And also the first time we brought a guest on. So we brought Brad Herremans, who is the CEO of Suncoast Community Health Centers, on today. Talk a little bit about his role and what community health centers do in our community, but also kind of what the role has been over the last few months in our community as well. This is actually National Community Health Center Week. As many of you know, we represent a number of local community health centers, as well as the Florida Association of Community Health Centers as well. So we thought it'd be appropriate to kind of bring Brad on. I think the theme this year is lighting the way for healthier communities today and in the future for Community Health Center Week. And I thought it'd be a great opportunity to kind of spotlight Brad and Suncoast. So welcome, Brad. Thank you for joining us. If you could kind of start off and maybe share with everybody what are the missions of community health centers in our community, and also what's your role as CEO? What do you do as CEO?
Sure. First, Ron, Natalie, thanks a lot for having me. This is this is neat. First experience of doing this, and I am very honored to be your first guest on Lobby Talk. So
no pressure, it's live, as I told you. So we're really excited. So
well, yeah, you were one of your very first clients ever, so that
no pressure at all. You know, well, hopefully it'll go a little bit quicker than the Lightning hockey game last week. So maybe we can get out of here without 5 overtimes and try to get this rolling. Community health centers. It is Community Health Center Week, and it's a big week for all the federally qualified community health centers around the country. It's probably one of the best kept secrets, I think, in the country. Community health centers are the largest provider of primary care in the nation. And as the local community health center here in Hillsborough County and a little bit in Polk County, that is our mission. We are the safety net provider for the communities that we serve. Suncoast, we have clinics as far south in Hillsborough County down to the Ruskin-Wamama area, as far east as Plant City, and all points in between. We also have an OBGYN practice over in Polk County that we work in Lakeland that we're very proud of. We have 450 employees, wonderful professionals, cared for over 63,000 patients last year. And obviously with the coronavirus, it has kind of turned our world upside down. But even with that, the biggest challenge we had when this thing first happened is okay, let's take a step back. Let's make sure that we are doing absolutely everything in our power that we can to make sure that our patients and our staff are absolutely as safe as possible so that we can continue providing family medicine, pediatrics, women's health, behavioral health, dentistry. Dentistry was a huge one when this thing hit. Your audience might remember that there was a period of time there where the governor actually shut down dentistry for a period of time, except for emergencies. And we did the same thing, of course. We closed down all of our dental clinics, except for our Brandon office, where we had 2 of our dentists, our dental director actually, and then our director of our pediatric dental residency program. And the 2 of them, very bravely, still stayed open and saw emergency patients. And they were the only 2 dentists in the area that kept going. And so I put them at the top of my bucket list as heroes. And luckily they were perfectly fine. They followed all the recommendations from the CDCs as far as prevention goes. And while they were going through that, it gave us an element of time to look at things that we can do in the community health centers to assure that we can continue to provide those routine services that are so necessary for everybody in the community, and do it in a we did is, we put ionization systems in all of our air conditioning systems. You think, okay, well, what's the big deal? Well, it cleans the air every time it's cycled through. And how this virus is transmitted, once it gets in the air handling system, it can be spread anywhere. So it's very important for businesses to put systems like that in place to make sure that that air system is cleaned. We really ramped up our cleaning that we do within the clinics. It's hard to even bend around or go around a corner here where somebody's not cleaning something. And then we also were very careful to utilize UVC lights. Every single clinic has them. We have a routine schedule that we go through to make sure that they're placed in all the common areas, in the exam rooms, in the waiting rooms. Most importantly, people don't even think of is in the restrooms, to make sure that those are sanitized. is what we have been extremely proud of is that while this is going on, we haven't had any cases where we can tell from contact tracing that we've passed a case from a provider to a patient or a patient to a provider while in our clinic. Doesn't mean that we haven't been affected by it. We have. Our staff and certainly our patients have tested positive, but they've all been done in settings outside of the clinic. So in one regards, I'm almost feel better when our employees are at work, because I know the environment that they're in and I know the safety precautions that are in place. When they're home or they're out in the community, I don't have control over that. And it makes me a little bit more nervous on some of the situations that they can do. There's been a lot of talk about wearing face masks and all those types of things. Without getting on anybody's bad side, here we require it. If you're going to come into one of our clinics, we ask you to wear a face mask, and you will see all of our staff will be in that too. That's out of respect, if nothing else, for you as a patient, and then we ask that in return for us as providers to try to keep everybody as safe as possible.
Brad, I know you're doing everything you can, following all the guidelines and probably doing more than what's expected. You do have a team of heroes at your locations, and so keeping them safe and ensuring that you can bring your patients in. I'm sure that it looks different today. What would a patient that's coming in, what would they experience today coming into your lobby that may look different than what they've experienced in the past?
I think probably the first thing that they would notice is that the chairs aren't all next to each other. And so obviously social distancing and trying to manage that is a challenge. When you're used to having a waiting room that have chairs next to each other, we don't do that anymore. There'll be certain situations where people might even remain in the car and they'll be texted when their appointment's ready. When they do enter any of our buildings, they'll be asked to have their temperature taken. And our staff will be out front to greet them as opposed to after they get into the clinic. Very, very common. There'll also you'll see hand sanitizers everywhere, for people to use, and we encourage that. So we try to make sure that people are in and out of the clinics just as quickly as possible, and so that it's as safely as possible, both for our staff and for the patients. And I know you guys mentioned before about the importance of continuing with routine care, and I can't emphasize that enough. We've already had some people that really it was time for them to get back into the clinic. You have cases of people that have got to continue with their routine health care, or what they're going to encounter with the coronavirus can be minimized. I mean, so what's the point if you prevent from getting the coronavirus, but you get yourself in a much greater situation medically because you forego healthcare for something else? Just a very difficult situation to put everybody in. One of the areas that has been very successful coming out of this thing, we've talked about it for years, and now this has really kind of forced our hand to do it, and that's telemedicine, telehealth. 10-15% of our visits now are telehealth, and it's really working out well. Our providers like it, our patients seem to like it. We're even to the point now, and this kind of sounds like, how do you do this? But we're doing it, where we're going to begin doing teledentistry. I know our sister center, Tampa Family, across the way, they've been doing teledentistry right along. And it's a way that the patients can still interact with their dentist and have that communication, and then put their mind at ease on where they're at with that aspect of their health. The other part that has really been influential is in the behavioral health side, to make sure those appointments don't go unmet and those services don't go unmet. Ron and Natalie, as you're both well aware, we integrate those services here at Suncoast. Whereas behavioral health just doesn't happen on its own. You're in a partnership with your primary. Sometimes you're in partnership with your primary care provider and your dental provider and your behavioral health provider. And it's a team approach to providing those services. Telehealth gives us one more tool to outreach to the families to make sure that those services stay on track. And it's just so important right now. And I mean, you guys sense it. And it doesn't take a genius to know that this is just extremely stressful on families, on people, on many regards. I chair the Behavioral Health Task Force for Hillsborough County. A lot of wonderful people sit on that group. We met yesterday, and the needs throughout the community for behavioral health are not going away. It's quite going the opposite. And so as we see that ramp up, providing those services and make sure that you have that continuity care are more important now than probably they ever have been.
Well, Brad, although you're our first, I'm going to have to debate ourselves whether you're going to be our best or our worst panelist ever, because you're answering every question before it has been answered. You're doing fantastic. But I do have one more question for you before we run out of time, and that is, to your point, that it's important that our families and those that come to seek services are continuing to receive those services that they would normally be having needs for, regardless of COVID or not. And we are in that back to school mode. And of course, school and reopenings look very different this year than we've ever envisioned them looking. But the needs that your students come to you for have not changed. So, if you can share with us, what advice do you have for those families that are in that midst of getting back to school ready? What can they be doing right now from a wellness standpoint for their kids?
I'll tell you what, right now, I think probably the loneliest person in this community has got to be our new school superintendent. Boy, I pray for him every day, and he and his staff have got some incredible, difficult decisions to make. I wouldn't want to be in his shoes. From a medical standpoint, from a healthcare standpoint, for the children though too, it's extremely important to continue to get your children in for their physicals. Make sure that they get those checkups. Make sure that extremely important. Make sure that they stay up with their immunizations. If they're required to do that, don't forego that. Make sure you get your children in and make sure that you have that taken care of. As a family, that's going to have to be a family decision. Personally, I think that the school district is going to do absolutely everything they can. I know the people that work down there, they're good people. They're working very hard with the Department of Health, and they're not going to put your child into harm's way. It's certainly not knowingly. And I think if they put the right measures in place, have the kids, and this is, children are children. You can have the best laid plans, and then as soon as kids see their friends, how's that going to work? So if you can get the children to wear face masks, and obviously hand sanitizer is extremely important. Social distancing is, as much as they possibly can. I'm sure they're going to structure the classrooms so that the desks are apart from other children. But how's it going to look on the buses? Not my business, but I'm sure that they're looking at all that. But it does become my business when it turns into a healthcare issue, because many of these children, we are their healthcare home, we are their health home, and we take that role very seriously. We've been in discussions with the school district. We provide the school-based dental program, where we go on site and provide dental services for second graders. That program itself has been delayed till at least January, so we can kind of reevaluate where we're at, as far as the coronavirus goes and the impact. But Natalie and Ron, getting back to your point though too, as far as preventive services, those are one of the preventive services that so many children rely on every year. For many of the children that we see in the schools, and we see a lot, we're in 38 schools in Hillsborough County that we go and care for the second graders. And for many of these children that we see, I think last year was up around 90%, it's the very first time that they ever encounter a dental professional of any level. Okay, so we're going to stop doing that program. Now what's going to happen to those children?
Well, thank you. I think that, all of that is sage advice, and I think that you're right. I think we've got a team of folks at the school district, a team of folks at our health department. We know that our community health centers and our hospitals and all of those that have been charged with these tough decisions and guidance, they're doing work that there is no playbook for, and they're doing it to the best of their ability. So thank you for the part that you and your team play. I know that you've been instrumental in rolling out testing and partnering with our community, and you guys have been heroes and have been very brave in every. I'll hand it back to Ron, and we'll do our closing.
Okay.
Brad, first of all, thank you for joining us for our first live edition of Lobby Talk. You've been awesome. So I appreciate all that you do in our community. And Natalie said, your team over there are truly heroes for everything they're doing in our community on a daily basis. Thank you for Natalie for joining us for the first live edition. And for everybody out there, Tune in. We'll do this again in the near future with another live guest, as well as our normal editions of Lobby Talk that we'll be pushing out, especially after the election cycle. As you all know, next Tuesday is election day, so please, everybody that's out there that can hear us, please make sure you do your part and get out and vote between now and Tuesday. Thanks, everybody. Thanks for joining us. Thanks again, Brad.
All right. Thanks, Ron. Thanks, Natalie.